Are your joints achier than you think they should be?
Has your mood been down in the dumps and you don't know why?
Are your energy levels chronically low and nobody can give you a good reason why that might be?
Your thyroid might be the problem. Stay tuned and we'll tell you why in the 50 Shades of Pain show. Welcome to the 50 Shades of Pain show. I'm Dr. Donish. I'm here with my co-host, Dr. Escaloni. This show is being broadcasted from Lexington, Kentucky at Wellward Medical, where we empower our patients with greater degree of knowledge to demystify pain and suffering. Today, we're talking about the thyroid and how it impacts pretty much everything in your body. Most people have heard of somebody having thyroid issues, but high thyroid, low thyroid, this tends to be a confusion in the community. Thyroid is a hormone that regulates a lot of other actions in the body. Everything from how you think and how you feel about yourself to your bones and how much calcium you're able to absorb, to your heart rate and how quickly your heart rate can change with different stimuli, hair, nail growth, everything that you can think of has some tie-in back to the thyroid system.
That's pretty interesting because all I'd ever thought about was the thyroid, and it has to do with maybe people who have a low active thyroid, hypothyroidism, and they gain weight easily. Yeah. It seems like it hits a heck of a lot more than that.
Well, it affects your metabolism, it affects how your body responds to injury, it affects a lot of different factors. And we don't really, we think about it from just the weight gain because that's the most obvious. But there's a lot of other factors that the thyroid can control and influence. In medical school, they always said if you've got dry and crackly hair, if you've got dry skin, if you feel sluggish, or if you're gaining weight, these are all concerns about the thyroid, but they're things that show up pretty readily up front. The things that don't really show up front are what's happening on the inside. Like mainly the ones that we are concerned about here at Wellward is how it affects your mood and how it affects your joints. And when it comes to mood, there's a lot of things that affect our mood. I mean, people will have a good day for no reason and a bad day for no reason, but there is a reason behind it. A lot of it has to do with the way our brain processes chemicals in what I call the happy juices of the brain, like serotonin, dopamine, norepinephrine. These are chemicals that see deficits. And your body has a reservoir of this, but it's also producing more of this. However, it needs to get the appropriate signals from the body to know how much to produce. And when your thyroid is dysfunctional or not working properly, it's not going to put out as much of the happy juices as you need. And so you tend to feel a little bit more sluggish, a little bit down, and that can escalate to a point where you really start to feel clinically depressed. And in those situations, a lot of times people will check or will start an antidepressant, but if they're not having their hormones checked or evaluated, very simple solutions can often go overlooked.
That's really interesting. I think I'm getting a better understanding how people have gone to maybe a practitioner, or they go to one of those high volume practices where they just check on you, like more antidepressants, more pills, more pills. They're not looking at the underlying cause. These people could have these symptoms for a long, long time.
Very true. And oftentimes the solutions are much simpler than here, take some drugs. There's a lot of thyroid issues that can be addressed or improved upon with diet. Oftentimes it does need supplementation, but there are dietary changes, which we'll talk about in a future episode, that you can make to optimize your hormone production.
Mm-hmm. Now, you'd mentioned something about joint pain as well with this. What's going on with that?
Yeah, so whenever you have an injury to the body, these injuries are repaired in a relatively fast manner, but they need the proper resources and cell signaling on what needs to happen and how these cells need to connect to each other. And a lot of that information comes through your thyroid hormones that are being produced and influence the different ways tissue heals. The other thing that it can do is it changes the connectivity between cells, which means that your connective tissue can become looser and more friable, more vulnerable to injury. And so you can not just have a slower response to repair injuries in a joint, but you can also have a higher propensity towards, or a higher likelihood of having an injury. So all of this goes back to how well your thyroid's regulating itself, and the fact that, if you're not attending to the full picture of the human body, very simple things can be overlooked. Everything that we do here at Wellward is trying to optimize your body to repair itself or prevent injuries from happening in the first place. So looking at these aspects are really important.
I like this. I like this way of thinking. So I think that you guys at home probably have a pretty good idea about general thyroid, like complaints and what you might want to look in on the side, especially if you're at home and you're thinking, well, I've also gone through that pathway. I've taken the antidepressants, but I still feel tired all the time, way more than I should be. I still have all this joint pain when I'm not that old, and I just really feel down in the dumps. If nobody's looking at your thyroid, that might be the answer for you. So if you want more information about that, you can look at further elements on our YouTube page. We'll teach you tons of stuff about how the human body works. And if you want some extra pro tips, check out our Wellward Warriors page for our special people on our Facebook groups.
That's right. Leave us comments below. We'd love to hear from you and what you've experienced in your workup. Or if you have any questions about thyroid issues related to joints and mood disturbances, by all means, use us as a resource.
Mm-hmm. So until next time, everybody, I'm Dr. Escaloni.
And I'm Dr. Donish. We'll see you soon.
Bye.